Good morning, everyone. Dr. FJ. Hello, rhinos. So, question today, the reported findings give an example like how long is it? Roughly 10 minutes. A lot is the audience, the patient. How some people are analytical, they're going to have a lot of questions, and you got to go through and answer those questions. Others, especially a referral or a spouse of someone who's come in and gotten great results, that might be 5 minutes. So it varies. It's not like the exact same thing. That's the biggest thing that when I got into chiropractic, it was very common for a lot of ROFs to be like 30, 45 minutes. I don't know if people are still teaching that or not. So unnecessary. Um, and if you're getting 10, 15, 20 new patients a week or more, you're gonna be working 80 hours a week. I mean, imagine 20 ROFs times 30 minutes. That's a lot of hours. And I'm gonna embarrass myself and do the math right now. That's a lot of hours, and you haven't even adjusted anyone. So, you're gonna exhaust, you're gonna burn out if that's what you're doing, and it's unnecessary. Yes, you have to build the value, of course, but that doesn't take 30 minutes of continuing to cover the same thing over and over and over and over again. So roughly 10 minutes for the report, and then you go adjust them. And that's really all you need. And again, it might be 15 if they have a lot of questions, maybe 20. That would be really, really long. And then a short one would be five. So, but again, you want to go in, and as always, you state the purpose of the visit. So, what we're going to do today is I'm going to review your x-rays, show you what's causing the problem, go through a plan to get it corrected, go through your insurance coverage, financial options. You can let me know what works best for you, and then we will go get you your first adjustment. Something along those lines. Let them know exactly what's going to happen. Then review the key points from the first visit. And this is really big. This is what a lot of people talk about matching and mirroring when you repeat back the key phrases and words people use. Well, that's what you're doing here essentially. And they did studies on waiters. And when they repeated back the orders, their tips went up 70% versus they just tried to compliment the person and do all that. 70%. So there's a lot of power in just repeating back what they told you. It shows you you're paying attention. It makes you feel important, makes them feel important, shows that you're engaged, you care, builds rapport. There's just a lot of power in repeating back what they gave you, and it kind of puts them back in that state, right? So you're clarifying the problem, you're labeling it, you're showing them how it's affecting their life. You're kind of putting them back. So, and you got to get all this on the first visit. But basically, you've had migraines for 20 years, and back pain. It's affecting your relationships. The back is making it hard to work, and you can't play with your grandkids or your kids anymore like you'd like to. All of those things, and then be specific, be detailed with it. Um, and then you are obviously the solution. So, all right, let me go through and show you what's causing the problem and what we need to do to correct that and allow it to heal. So this is not a problem that continues to deteriorate. So that's really, really important. It's just repeat. First of all, you got to take the 5 to 10, 15 minutes at the first visit to gather that information. Super important. Why are they there? Right? What have they been through? And the people, some people give it to you right away. Other people, you got to dig for it. Um, so showing them it's a chronic problem that's been there a long time. It almost always is. Very rarely. And if it's not, it's usually a severe problem. So then the value's there. If they're in excruciating pain, they can hardly sit. You don't have to really build value. It's there. So you can just, this is what's going on. This is what we need to do, blah, 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 and get them moving in the right direction, right? Because they're hurting like hell. They know they need to do something. It's more the chronics that like it's uncomfortable, it's annoying, it's there a lot. They can do everything they want to do, but they're just not enjoying it like they want to. So those people, if you don't communicate the value, and again, you don't have to be all day, but if you don't communicate the value, and for those people also too, foreshadowing, right? Like it's gonna get worse. It's gonna get worse. And then it just gets harder and harder to correct, takes longer and longer to heal. the longer it's been there. And that's logical. So those people, they, if you don't handle it right, could just keep doing what they're doing. They could keep living with it. Because a great phrase you want to hear at some point is, yeah, I know I need to do something. I got to do something. So that's what you want to bring them to. Um, and then obviously differentiating yourself through that, then you don't have to worry about competing on price. But foreshadowing is really big. Now, if they're, again, in so much pain they're crying, they know it's bad, right? And if it came out of the blue, then you go, well, this doesn't happen overnight. How this happened is 20 years of it slowly and silently degenerating. And that's a good line to use for it's not, and again, I'm always stating the purpose. I'm always reviewing their key points, always. But I'm not using the same, and I've gotten to a point now where I've done so many ROFs, but I'm not using the same thing on everybody. It's not that I'm not reading a script. I'm having a human conversation, and that's a big thing. Have a human conversation, be the doctor, be the leader, okay? And go through. And then again, what I've been talking about so much that's helped me a lot is one, state the negatives ahead of time. So yes, we got to see a lot to get this corrected. How do we stabilize the spine? We see a lot, right? How do we make changes on x-rays? We see a lot, or we take re-x-rays, whatever it is. How do we stabilize the spine is a nice line. We see you a lot. And that's before you made the recommendation. Okay. For the higher end stuff, yeah, it is more expensive. I mean, I'm a lot more expensive, right? When people do upper cervical, it's double the cost. They could go down the road and spend 45, a couple offices 40, or they can spend 95 with me. So I have to differentiate. Like, yes, we are more expensive. I always say that right at a time. We're usually double or a little more than double. But what we're doing is completely different and it's far more effective. Okay. I'm not going to bad mouth the other. I like, oh, they're a joke, but what we're doing is completely different. But it's very, very effective. So that's really important. The foreshadowing can be really good for some people, letting them know like, hey, 10, 20, 30 years down the road, it's only going to get worse. Um, and then, yeah, differentiating, but stating the negative ahead of time, the expense or seeing you a lot or the visit's quick, whatever it is, call it out ahead of time. When I like with Nuka, it's weird. I'm pushing on their ear. So I call it out. It's weird. It's very different. It's hard to believe. It seems like we're selling snake oil here. But it's the only reason I switched to it is it's far more effective. It was much, or whatever, and everyone does what they do because they believe it's really effective. So convey that message, say what needs to be said, but no more, right? So just cover it. You don't have to cover it 18 times. Like, oh, let me show you another image of the degenerative disc disease. Oh, let me show you it again. What's worse than subluxation, nuclear war, or cancer? You don't have to do that nonsense. You can do big plans and just use the laws of persuasion and influence. Use them. Okay. The social proof, the authority, the consistency and commitment. And that's where you can get them, moving towards it. So and that's what also reviewing the key points is really important because you like whatever they want, getting them commit to that. So you want to be able to play with your grandkids again? Yes. You want to be able to, walk normally without pain? Yes. Just getting them to make that little commitment towards that. And I like no frame questions. That FBI negotiator changed my opinion on that. I used to be all yeses, but I like some no in there too. No, no, no. Getting them to say no ahead of time is kind of like stating the negative. You're getting it out ahead of time. So you're disarming them. But getting them to make those small commitments towards what they want is really powerful. Little by little, right? Same way they call people ahead of time, political parties, are you going to vote? Yes. They make that little commitment, and then like 20, 30% more people show up to vote. Or restaurants, will you let us know if you can't make it? And like 20, 30% increase, a reduction in people no showing. Just that little commitment. It seems like nothing. Super important. So that's why reviewing the key points and reviewing of course, they want to get out of pain. You want to get out of pain, right? Yes. And that's going to allow you to play with your kids, because I want to focus on re-exams, not the pain. You're going to have aches, little aches and pains in here and all this stuff. I want to focus on function and getting them to make commitments to that function. Okay, you're just waking up 8 times a night. You'd like to sleep better. Yes. So those little commitments are big. Then you review the x-rays, which, however you want to do it. Are you a curve person? Are you this? Are you that? The easiest thing if you have no technique is those flexion extension, and you're just showing that the spine's moving better after so many adjustments. That's the easiest thing to change. So if you have nothing, just do that. Do a flexion, do an extension, look at where they're locked up, and compared to, and then you have the regular lateral, and then you show them after 3 months that it's moving better. And it's almost always that one's the easiest one to change. So it's a nice, easy way to you know, to make sure you can deliver on what you promised. Curve's much more difficult. Centering the head and neck, much more difficult. So, but whatever. I mean, use your technique, review the x-rays. You don't have to do overkill, but just show them what's going on. They don't know what you're looking at. So just that's all just you conveying your authority and that you know what you're talking about. Only takes a few minutes. And I remember I learned this from he was a Pedabon doc, and back in the day, he had a really successful Pedabon practice, and he was like, at the end of the day, it's authority and confidence. They have to believe and know that you know what you're doing, and it's so true. And then when it comes to the money, you just have to be indifferent, totally indifferent to it. You have to just kind of picture in your mind that it's like $5, like it's nothing. And the more indifferent you are, the more successful you're going to be. You want to get all nervous, and then you get insecure and you're like, oh, but it's so worth it. None of that. Yeah, it is more expensive. Could you go down the road and get, if there's a joint near you? Yeah, you could. But what we're doing is completely different. If you go to a high-end steak restaurant, they're not sitting there trying to sell you on why they're better than McDonald's. You know what I mean? So all of that, and it seems like so much, but once you have, that's why I don't like, I mean, it's important to have in the beginning to practice you're saying, because if you don't practice, you're going to tend to way over talk. And too much of that really tends to convey insecurity, and you don't want that. So that's why it's important in the beginning to really go through and just practice those out. But then once you've done it for a while, it's more about, and you always want to be having a human conversation. But once you've done it for a while, I just like having an outline, right? Like state the purpose, review the key points, get a minor commitment to what they want, show the x-rays. This is where you're at. This is what we need to do. Any questions? No. Boom, 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 boom. This is going to get your head on straight, blah, or whatever. We're going to bring your curve back over. It's going to take pressure off your brain stem. Bring your head back over your body, unstretching the vagus nerve, whatever it is, improving CSF flow and blood flow to and from the skull, help level out those hits. I'm showing a nasium on everyone because it just makes me look completely different. Even if they're only a low back person, I'm explaining how all this is controlled up here by the brainstem. And that, I mean, I love upper cervical. I'm an upper cervical guy, but you can do it any way you want. So long. So that's kind of an example. And then you go through. So then you're going to, go through. This is what we want to do. Get your head on straight. How long does it take? Then you go through tissue healing. How long does nerves and soft tissues take? About a year. Then muscles, 3 months. That's why we always focus on 3 months. After that, you're going to be much more stable. We don't have to see you as often. How do we stabilize the spine? We got to see a lot. Boom, boom, boom. So then tissue healing time. Then you go 3 responses of care. And I say, 60% of people feel better, 30% feel the same, about 10% feel worse temporarily. Dr. Fred was always a third, a third, a third. It's whatever you want. 30% feel better, about 30 feel worse, about third feel the same. And then the Cox, I think, teaches, you could ask, but it's like 20% improvement in 30 days and like 50% in 60 days and 90% in 90 days, something like that. And it just gives a nice, because whatever you want to say, about half people feel a significant amount of improvement after 30 days. After 60 days, you're looking at 80%. Just whatever you want to do, whatever your technique sides. Cox has got a lot of good numbers on that, though. And it just, again, doesn't really matter. You can make up numbers if you wanted to, but it's about your authority and you knowing that you can help this person. And that, at the end of the day, is what they're buying, is your perceived competency, your skills. That's what they're buying. And that's how you have to convey in these 2 appointments. So how you look, how organized and clean your office is, how professional and all that conveys to them that this person knows or doesn't know what they're talking about. And you can have the perfect, a great script, and everything looks a mess and unorganized, and you're super nervous and anxious and uncertain, and no one's going to buy. So the biggest thing is you just doing everything you can to be 100% comfortable in that room. That's why Dr. Fred has always taught take a deep breath before you go in, center yourself, relax. Everyone's not going to do it. That's fine. Everyone's not going to love you. That's okay. Some people are going to walk out and not want any of it. That's okay. Your practices, life carries on. This too shall pass. And so sorry, I'm kind of rambling on. This is a long answer, but okay. You went through the tissue healing times. You went through the three responses to care. You go through your care plan, whatever it is, three times a week for 4 weeks, twice a week for 8 weeks. Any reason, and that's where I've changed. Instead of trying to get a yes for this, I'm like, any reason you can't get here that often? No. Great. Then I just go through what the office visit costs. So whatever. It's 95, 85, 55, 150, whatever it is. And we're going to do X, Y, and Z. So that's my normal adjustment, 95. We're going to do NUCA. We're going to do regular chiropractic. We're going to do PMF, boom, boom, boom. Some people call it value stacking or loading. Basically, you're covering the features. And obviously, the more you can show there, the more it's going to seem that's value. We're going to do re-exams every month, re-x-rays. I re-x-ray a lot. And I used to show it's $975 for a one-time fee for all the re-x-rays for 3 months. I used to put that there, but it just created a lot of objections. So I wouldn't write all that down. I want to know what one visit is. So 50, 90, 150, whatever. So I write that out, boom, boom, boom. Or say insurance is you got a $20 copay and then it's 45 non-covered service. So it's 65 office visit. And then if they have 100% coverage or a really low copay, I will tell them like we can just do that. It's a quick adjustment. That's all your insurance is going to cover. And I'll take it, right? I'll take the whatever. $10 copay and then 40 bucks on the back end. I'll take 50 bucks, 2-minute adjustment, and you can just come as you need. We may not get the results you are looking for, but we can absolutely try it if you want. And if we're not getting there, we can always, come back and look at doing a more in-depth approach. But I always offer the out, let me know if always offer the out. That's why that takes a lot of the pressure out too. If it doesn't work for you, let me know. Yeah, I think decompression would be great for you. It is very expensive. It doesn't work. Let me know. Let's do it once, test drive it. If you don't want to do it, I won't charge you for it. And so many people will do it. And you've just taken all the pressure out of the room. So you've gone through the features, then you just write it up. Okay, per visit, one time, auto debit. You can have it pre-filled out. Math is done. So 24 visits, re-x-rays, re-exams, comes to 3,000. You can take care of it up front. It's 25% off. Saves our front desk a lot of time. So we give a large discount. That takes it to 25, 22. And auto debit, whatever, 832 a month for 3 months. And then you go from there. HSA, flex spending you can use, care credits, fine. That's getting more popular, no problem. Any question for me? No? Which works best for you? And if I do have to decide today, no, absolutely not. You can let's get you a full adjustment. We'll get you a copy of this, and you can let us know next time what you want to do. That a lot of people don't like to do. I've done that for years now, and we're still at that like 65, 68% conversion rate. And if it drops down, we know the quality of the new patients coming in is bad, so we usually tweak our Facebook ads or something. And if it goes high, then we know the quality is really good. We want to just keep working that. So that is an example of the ROF. Again, it sounds like a lot, but 10 minutes is the average. Then you go adjust them. Okay. Some are a little longer, some are a little less. But just cover those outlines, those basics, and have a human conversation. Right? Be comfortable, be indifferent. If you don't want to do it, it's fine. Let me know. No problem. That's the beauty of having double digits. It's like, oh, it's okay. Well, there's other guys in network. Yeah, sure, no problem. And the more you push them away, the more they want to stay. Yeah, yeah. If you want to go try the in-network guy, no problem. I'll send the x-rays over. Go for it. I get it. And some will. And if you're unhappy, you can always come back and we'll get you fixed up. So that's the ROF. Any other questions, please let me know. I hope that helps. It's a super important, but again, the consult sets the foundation. The consultations, the offensive line, it gets zero credit, but it's so important. And then the ROFs, like the quarterback and the receivers, they get all the credit. Um, but it is really important. You got to do both really, really well. And I was just talking to my office manager about like we got to really make sure we're doing these things right, and we're sticking to the fundamentals because that's where 90% of your collections are going to come is those first and second visits. Then you got to give it a good adjustment, all of that, of course. But the first impression is gigantic and that's why it's so nice to get that commitment because they'll just stay so much longer. Yes, you'll get some refunds, but they'll just stay so much longer and give you a much greater chance to help. And for the chronics that are tricky, you have a much greater chance of helping them if they commit to that 3 months or 6 months or 12. What do you like to do? I like 3 months. But so that's it. Hope that helps. Any other questions? Let me know. If not, have a great month and keep charging.